from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, Dr. Laura Wilson of Shorewood Family Medical Center joins us today. We're going to talk about concussions, which has been in the news a lot lately. I think awareness going up for these, but maybe some things you didn't know from Dr. Laura. Good to see you.
Thank you. Thanks for having me.
First of all, the sports.
Right.
We all think of football, I guess.
Right.
Yeah.
Well, let's start kind of actually with what is a concussion, because people seem to be a little bit confused. A concussion is a type of minor head trauma or minor traumatic brain injury that follows a blow to the head, or even an accelerating type injury like a whiplash. So you don't actually have to bang your head, but something that almost kind of rattles the brain.
Okay.
And I thought it'd be pertinent to talk about it this time of year because we're in the heat of all of our athletic seasons.
Right.
Football, soccer's going, all that. So we did a little research. We found the top 4 sports for you. I'm sure everybody can figure out number 1.
It's football.
Football.
No surprise there. And there's been a lot of awareness in the NFL and even college and high school sports.
And just in the past probably 5 to 7 years, I think it's great that really people have become more aware, because it's probably more common and more serious than we ever realized.
Right. Okay.
But football, number 1. Number 2 and 3, hockey and lacrosse. Not as big in Arkansas probably, but certainly there's some athletes out there. Yeah. And number 4 being soccer. Soccer is actually the top cause for female athletes. Okay. So the other 3 more for males, soccer for males and females, but soccer the highest for females.
And a lot of the younger ones are playing more soccer than we did as kids.
Right. And so just the sheer number of kids playing increases the risk for that sport, right?
Yeah, exactly.
And football's in that same kind of category.
I think so. And we did mention that we saw a piece on cheerleaders this morning on Good Morning America, because sometimes that gets ignored.
Well, they take huge falls, and it wasn't in one of the top sports, but definitely there's a risk with the high-flying stunts they do.
Yeah, falling from the pyramids and such. Okay, let's talk about the signs of it then.
Sure. So the signs of a concussion, usually you're going to have some loss of consciousness. Well, let me backtrack a little bit. You're going to have confusion, loss of concentration, maybe some drowsiness, dizziness, headache. All those things can happen in the moments or the days afterwards. The loss of consciousness actually is not as common as you would think. Only about 5 to 10% of our athletes have a loss of consciousness. So most people would think that loss of consciousness is part of the diagnosis, but that's actually not true. We're looking at about 90% that don't experience that.
It mentioned nausea as well there on the screen.
Nausea, vomiting, of course, goes with it.
So those things can happen right away, or maybe over the weekend or the next few days.
Right. Most kids will have some symptoms at the time of the injury. They'll feel a headache, they'll feel a little out of it, a little drowsy, but kids can actually not have a lot of symptoms immediately and then develop those over the next day or 2 or week even.
Okay, very good. Okay, so let's talk about the guidelines then and what your suggestions are.
Well, first and foremost is immediate removal from the sport. And I know these young athletes want to stay in and they want to play and they don't think this is a big deal. But if a kid takes a ding to the head or gets his bell rung, that would be a head injury with any kind of neurologic symptoms, that kid needs to come out. Okay. And for the entire game, that kid needs to come out.
Come out, sidelines, or go home.
Right, exactly. Yeah. If the kid has significant symptoms at the time of the injury, they need to be evaluated that night. If the symptoms are pretty mild, perhaps it could wait till the morning with their primary care doctor. But what the doctor needs to do, number 1, is diagnose the concussion, but also rule out more significant brain injury, like a bleed or something that might need surgical intervention. Now, thankfully, that's pretty rare. Right. We need to make sure something more serious is not going on.
Yeah, so, okay, so if you pull them out from the sport, how many days are we talking usually?
Right, so the biggest thing with the guidelines in returning to play is a very gradual return. So typically you want to rest for a day or 2. So that may or may not mean school, but just very general rest, no physical activity, laying around a lot. Yeah. And then after that, gradually returning to your activity level. So the first would be some light aerobics. You want to try that to see if you have symptoms. If you have symptoms at that level with light aerobics, you're going to stop there. And you're stuck at that phase until you go beyond. So if you can start doing light aerobics without a headache, without drowsiness, without feeling super fatigued, then you move to the next level, which is moderate exercise. And so again, it's all very graduated and based on the individual. It can take 10 to 14 days. It could take a month or 2.
Oh, okay.
Now, most kids within 2 weeks have recovered, but some it will go on even longer.
Yeah. Aren't you glad as a physician that this awareness is up there now?
For sure. And it's really interesting. A lot of families are surprised when I diagnose a concussion. I guess people still think it's kind of an out there thing, but it's pretty common. One of the other things with concussions we really want to watch for is a second impact. We know that there's something that exists out there called second impact syndrome, which is actually if you have another hit while you're still recovering, there's actually a risk for immediate death, which is very, very scary. Now it's rare, it's super rare, but we also have evidence now that shows repeated concussions increases the risk for Parkinson's, Alzheimer's, and other types of dementia.
A lot of studies being done on, especially NFL players.
Very scary when we're talking about our young athletes and developing brains and all this.
Right. Okay. Things that all parents need to think about, and best thing, pull them out if you have even a doubt, really.
Right.
Okay. We need to put up the information, of course, about Dr. Laura's place, of course, in Sherwood. You could always give them a call if you have any questions about your family's health. There's the information on your screen. Thank you,
Thanks,
Dr. Laura.
Melinda.
Appreciate it.